Digital transformation is a popular buzzword that triggers fear, defensiveness, and sometimes outright panic. As leaders in the ever-evolving technological landscape, how do we get better at leading organization-wide change, even in slow-moving or complex environments? What are some insights from neuroscience that we should be considering to improve? Marketing and sales are full of myths, misconceptions, and sometimes even flat-out lies. Join us as we get out of the echo chamber and try to find the human touch in the age of digital transformation. Hello and welcome to the Rethink Marketing Podcast, where we cut through the hype and confusion of conventional marketing advice and try to provide some actual benefit. Unfortunately, Paul Froge was not able to join us today because he is dealing with a fire to put out at his agency, so hopefully he's able to take care of that without singeing off his eyebrows. But I am so excited that today we're joined by a fantastic guest with an array of experience on the data science side, the digital transformation side, and of course, technological implementation. So with that, let's go ahead and invite him into the conversation. We're joined today by Dr. Maulik Purohit, the head of innovation at PAM Health and a board member and advisor to multiple organizations. He studied physical medicine and rehabilitation, PM&R, at Harvard Medical School, subspecializing in brain injury medicine and neurorehabilitation. He helped run the first brain injury center of excellence in the Department of Defense and has led digital transformation, data science, and information technology teams across a variety of health systems. Dr. Purohit specializes in leveraging neuroscientific principles behind executive leadership and cultural change to create better performance and optimal results. He believes that to be successful, you must ensure alignment on priorities organization-wide. Welcome to the Rethink Marketing Podcast, Dr. Maulik Purohit.
Wow, Colin, that's a fantastic intro. Thank you so much for such a kind intro. It's a great honor and pleasure to be on here.
Well, again, probably could have gone on for the entire 45 minutes just introducing you because you've done so much in your career. But when I think about digital transformation, especially for health systems, obviously I work in healthcare, you've spent your career in healthcare, and healthcare gets ribbed for being antiquated and slow moving and all the things that it really is in a lot of regards. That's why venture capital and private equity love the up and comers because they can be disruptors. But you've led digital transformation projects across big health systems. Just, give us a little bit of insight as to what have some of those learnings been as you are trying to move a health system from being antiquated and outdated to patient-centric and technology first?
Yeah, great question, Colin. And I think healthcare, I think it's a knock for being behind the times in technology, and I think it's well deserved. But there are reasons behind it too. So it's not simply that healthcare doesn't want to move, but historically the way it's happened, and one of the reasons that it's been historically behind is there's no incentive to do so for a long time until the High Tech Act and some of those things. There's no financial incentive for a system to want to digitally transform, and so I think that that legislation helped speed up the transformation quite a bit. And for those that may not be aware, most health systems run on about a 2-3% margin. Now, sometimes because you scale and you have a large organization, that 2-3% might mean several hundred millions for some organization. But in general, most systems work on a 2-3% margin. And that seems small, and it is. And it's amazing that health systems can function that way. To give you a comparison, software, for example, a software company typically works on a 60 to 80% margin. So a huge difference in the profit margin that's there. And that money allows you to invest in things in the future, right? And so if you're a software company, your software is your product. And as the result of that, you've got the margin to then do R&D and keep going forward with that and invest and get better and better. But if you're at a 2-3% margin, and you've got to invest that dollars back into the organization, and you've got your normal salary increases every year annually, right? You've got your normal updating of buildings and facilities and that kind of stuff. You've got your legislative and regulatory costs, right? I think all of those things eat up that 2-3% very quickly. And so it's hard to do things that are novel or innovative and take that risk. Now, it's not to say you can't do it and you can't find better ways. You can, but that historically has been one of the reasons that healthcare is not invested heavily into tech. And then the other part of this is not that they have. I think one of the things that we see here is this background of everyone doing it fast because the incentive was there with the High Tech Act, and not doing it together. And now it's sort of making up for that, right? Because it's sort of like the old days, the story in the 1800s when they put railroads in the US, and they built on the east and built west, and they had one size width for the tracks, and they built from the west east, and they had a different size for the track. And as a result, the trains couldn't go, right? And so they had to rethink things. And it's the same thing here, is that we haven't had standardization in so many ways. And in technology, we see that. I know one, like nuisance, for example, just a small one, has been charging cords, right? If you have an iPhone, if you have an Android, if you have something else, right, you can't make them compatible, and it's annoying. And so within the household, if you have different phones, then you have to have different cords, and it's a whole infrastructure, right? For the car, for the home, for the office, et cetera, right? And that's just one example. And then in healthcare, you have the same thing, because you have different EMRs, you have different setups there, you have different rules and regulations each site. And the thing that makes healthcare tough with digital transformation is the regulatory oversight of things. So, for example, just this minor thing of, let's see if somebody was an MA, a medical assistant helping with vital signs, whatever. If that medical assistant is in a clinic that's separate from the hospital, there's one set of rules. If that MA is in a clinic that's based out of a hospital building, it's a different set of rules. If that MA is in the inpatient side, it's a very different set of rules. And it's really hard for an IT setup to account for. That's just one individual in 3 locations. And then you add in like county rules and all the other stuff, and state laws, and all the different things that people have access to. And when you add in that complexity of design of the operations, it's really hard for any IT system to really do that well in a facile way and make it user friendly. So there's that background too. Now, these may sound like excuses, and they certainly can become excuses in the future, but that is the backdrop to where digital transformation is today. Having said that, the other part of digital transformation that I think really needs updating is our imagination. And to me, this is the real area we can focus on. Is I think healthcare systems are, in many ways, the leadership of healthcare systems oftentimes are the least imaginative of how we can do things. And I think we have this traditional, in some ways, we talk about generation gaps, and I think that certainly exists between the C-suite and the rest of the world. I'll give you an example of certain things in schools right now, and I learned this from my kids, is they all are on Google Workspace. We've been in the last few years, we've been in 3 different cities across the country, 3 different school systems, and they're all on Google Workspace because it's easier for collaboration. It's a Chromebook you just give out and go, and they don't have security issues because that Google Workspace is pretty secure. We can do that same kind of thing for healthcare systems and use a more modern platform that makes it much more secure, and at the same time doesn't make it onerous for someone to log in. I'll tell you, one health system I worked on, I actually timed the logon process for my anesthesiologist in the OR. I actually, as CHIO, I shadowed him in the OR and just watched him log on. And as the anesthesiologist have to go from room to room, it's not just one stationary place. But each time he logged on, it was 8 minutes.
Oh my gosh.
And it's crazy, right? Because when I see my kids, they just, boom, they're in, right? And if you work at Google, it's the same thing. Your security is so strong, you don't have to have a lot of the mischief, let's say, in terms of, the VPN, the login, the 2-factor authentication, all that kind of stuff, right? And so all that adds to someone's burnout in a given day. And so I think, to me, digital transformation, the most important part is having the right imagination of what can be and where we need to go. And second is getting the whole organization to buy into that. Because when we talk about digital transformation, you said we're going to and transform the organization, have a plan. Start somewhere and then go down the list. But at the same time, don't have 25 top priorities. It's and if you're truly wanting to do digital transformation, focus on that and make that your top priority, and don't add to everybody else. Because as CEO, it's easy to say these are all our top priorities and have that delegated out to your next EVPs and SVPs and et cetera, and down and down. but it burns up the people that are doing it because it's all the same people and all the priorities, right?
Right.
So, and that entire leadership team, if they're involved in 25 priorities, or those priorities are competing with each other in different departments, you're not going to move the organization forward. And so to me, this is where the neuroscience and the digital comes together is how do you structure your team and your leadership and culture in a way that allows you to row together rather than rowing in different directions on the same boat. And oftentimes that to me is the biggest challenge is getting everyone in the organization to row together because they're incentivized differently. They have different goals. They have different annual plans that they have to meet. And that is to me the biggest barrier of digital transformation in healthcare is not everyone being aligned together and having that discipline and having that culture to get everybody on the same page and say, okay, we're not going to do your goal this year, but we're going to do this goal. But within that goal, everyone's got a piece to play and everyone has a role, and your incentives and bonuses and everything else will be calibrated to that goal rather than meeting separate goals. And so it's a long-winded background, Colin. I apologize for going so long, but I think there's so much depth to this topic that it's hard to do it in 30 seconds.
Absolutely. And I wouldn't expect you to answer a complicated question like that in 30 seconds. But I'm so glad that you brought up the idea of culture because when I'm engaging with marketing leaders who are in health systems, one of the major complaints that they have is generally culture because the executive team or the board of directors look at something like digital patient experience and they're looking at it as a kind problem, right? We're at point A, we need to get to point B, go get us to point B, not as a wicked problem where, okay, what does that actually mean? Let's define the objectives. Let's define the platforms. Let's talk to various stakeholders because yes, we want to make patients happy, but you mentioned the MA. We also have to make the frontline healthcare workers. We have to ensure that they're happy with the process and everything because we're losing physicians, we're losing nurses, we're losing MAs to burnout and a lot of other things. So when you're framing these types of questions and these types of issues, how are you looking at them as wicked problems and ensuring that, hey, first we have to fix the culture before we can really get buy-in?
Yeah, that's a great and Colin, it's a really astute, smart question. And I think that's where the first step is. And the challenge coming out the last few years with COVID and everything else, right? You had to address COVID as your top priority. There's no choice around it, right? And that I think burnt out a lot of people because they had to funnel everything to that. But yet you still have to maintain the house and do other things, right? And so it created this huge length of work days and nonstop work for a lot of people in healthcare, particularly because you have your IT teams that are managing the COVID infrastructure and also all everything else that's got to go on as their maintenance and housekeeping, right? And so, but I think now that we're coming out of this phase, and we should have been for about a year now, at least, is things are a little bit more stable. And now the idea is, can we actually evolve as a healthcare industry completely and say, let's first focus on the people that are in healthcare that are working. Now we got to take care of patients, but there's an interesting book called The Patient Second, and I love the concept of that book because it's puts it into a healthcare perspective, but it talks about creating the right infrastructure for the people that work in healthcare so that they are able to care for the others that are in the system. Otherwise it becomes, and I guess I'm going to date myself, but this is an old movie called Office Space. And
Yes, I'm
and
very familiar with Office Space. It's all too relatable in today's environment as well.
and and so within that movie, it talks about this individual worker who's constantly every day not able to perform his job because he has to fight the fax machine. He has to do these like owners TPS reports, but I still don't know what they are, but he has to do these reports, right? And it's just this busy work of other things that get in the way of your actual job, which then frustrates him and then causes his boss to ask him to work extra without extra pay for the purpose of getting the job done. And if that sounds familiar, because that is what all of us do right now, is we have these impediments to our actual job because we fight the infrastructure. And one health system I've been at, you log in, you have to have a VPN, you have a two-factor authentication, and then you have, multiple passwords for multiple apps that are running. So this login process alone, you've already tired out somebody from the process. Not only that, but you've given an additional cognitive load of doing these things that distracts them from anything else that they're doing. And so that to me is what leads to errors and mistakes. I think this is a sort of an undercover topic of the digital infrastructure creating safety issues for patients because we're distracted by the structure and then distracted from the patient and thinking about it, right? Like if I want to go into the EMR and simply change a medication for somebody, but it takes me 15 steps to do it. By the time I've gotten to the point where I need to change the medication, I may forget or make an error. And I think this happens more often than we realize. And so I think having the right digital infrastructure is really key to taking care of the people who provide care and taking care of the people that need care. And if we take care of the people that are working, that gives them the time and the space to then actually care for somebody else. If you're so busy that just fighting the system every day, you're going to get burnt out very quickly. You're going to get distracted from the patient care. You're going to get distracted from other things. And it's also hard to maintain compassion and empathy and care for others when you yourself are frustrated with what you're doing. And so these are the kind of things that are should be a big topic in terms of healthcare and where we want to go with this. And so in digital transformation, we're seeing some push with this, right? We've seen, for example, documentation. There's several companies over the last year that have really dramatically changed the landscape for people. But here's the other part of that, though. The ROI that health systems are using to bring those systems in, which is supposed to reduce the workload, the ROI is often, let's add patients to your schedule to pay
Right.
for the tool, right? And so now, instead of actually reducing the work, you've just shifted the work to something else. And so I think we have to be really careful that digital transformation is about caring for the people and having that as your North Star, rather than being about enhancing technology or being in the papers for having a cool contract. And really about caring for the people that are within your walls and the people that are coming to you for care.
That's huge. And I really appreciate the way that you're framing that because I've seen so many organizations think about crawl, walk, run, and they sort of skip the crawling phase and they go right to the walking, running phase where they're implementing AI to help with note taking and charting and things of that nature. And they're skipping the fact that it takes them 8 minutes to log on every time they walk into a new room. And so just thinking about what is that? And I don't even want to say low hanging fruit, but what are the encumbrances that are leading to staff burnout? And how can we adjust those and actually empower people to serve patients better, to serve our customers better without the encumbrances of a lot of technology? Like you mentioned, logging into your VPN and doing two-factor authentication and those sorts of things. I don't have to do two-factor authentication to go from my Gmail account to Google Sheets or to YouTube or, to Gemini, what have you. It's a very seamless process. So yeah, that's really insightful. So when you're considering basically the ROI, it feels like part of the ROI consideration for any sort of technology implementation should be some cultural metric. And I know it's really hard to put numbers to culture, but we could look at things like employee net promoter score or staff churn, average tenure at exit, those types of things. When you're looking at how we're leveraging technology from a health systems perspective, how do you consider those employee metrics?
Yeah, it's a great question. I think a couple of things here I'll say is before we get to the metrics is about really what we're really trying to measure, which is the pulse of the team, right?
Yes.
And so uh, what happens a lot of times people feel like is, oh, you're getting this technology, you're doing it to me, and it doesn't really benefit me. It might have benefit the organization, but it doesn't benefit me. And but it does add work to my schedule, right?
Right.
And there's also this thing where like if you're a hourly worker and you have to stay late, you at least get compensated for that late time. But if you're a salaried person in the organization, right, then they don't really count your hours. They just assume that you're going to work whatever it takes to get it done. But there's a price to pay for that, even if you're not paying it through salary. And so The idea is, can we do technology that is truly transforming the care and the experience of everybody involved versus transforming the infrastructure at the expense of everybody involved, right? And I think that's a big difference between the two, because you can do transformation either way, and I've done it, but I've been on both sides of it. But I think really understanding your people and understanding what they're thinking, right? And going back to the neuroscience aspect, anytime there's change, the default response for most people's brains is to get into defense mode. And to get a little bit nerdy on this with some terms, but there is the concept of the amygdala, which is sort of the fear center, so to speak, in the brain, tied with your hippocampus, which is the memory center. And they're very close together in the brain. And they're close together by design, because you want to remember the things that cause you harm and threat so that you then activate your body to prepare for that. And so for most people, though, when there's change, change is often negative because people assume that there's a loss. And we're trained to think of that because that's a defense posture. Like if you think of us in not today's world, but say, 20,000 years ago, and we're in hunter-gatherer mode or whatever it may be, the likelihood of a change being positive for you is very low, right? If you're in the forest or whatever, you see an animal, that likelihood of that being a positive change for you is very low. So our brains have evolved to look at change as a negative thing off the bat, even if it's a positive change. The initial response is this fear response, which then leads to a stress response, a fight or flight. And so to me, the first step in any change or transformation, and what makes it transformation versus change management to me is, are you accounting for this immediate response in people's brains of fear and stress? And a lot of that really depends on communication and involvement from the stakeholders, not just your C-suite, but your front line in decision-making, in process, timelines, etc. And so you can mitigate that stress response and maintain happiness in the organization if you just take the common step of treating humans as humans and saying that, if I had said, Colin, let's say you and I are friends, and I said, hey, Colin, we got plans for dinner next week. And then that Friday morning, I say, I can't make it, but I give you a communication and say, Colin, I'm sorry, I'm really looking forward to this, but I had this come up and I'm so sorry, can we postpone it, right? You're like, no big deal. That's fine. But if I just don't show up and don't communicate with you, there's a whole different response, and rightfully so. But that's exactly what we do in many ways to our people, and we don't communicate exactly the way we need to, or we communicate a message that artificially sounds very happy and positive, and without any details to show why it's that way. And people are always suspicious because they just assume that any change there's something else, and if you don't give details, then you're hiding something, right? So it's very important to communicate in a way that builds on trust, that's transparent, that provides sufficient detail and references, and a place to come in for questions. And so to me, any transformation you do starts with that initial thought process of, okay, change for most humans means threat. And threat means stress response. And stress response means defensive posturing, which then handicaps your ability to do change. So, but you can mitigate all that through the right culture and the right methods of communication. And, your marketing background, like there's marketing is genius in knowing ways to communicate, right? That sends a good message. And we've seen good marketing and not so good, right? But, and there's good ways to communicate that engenders trust and builds competency builds your competency with the audience that you have. And to me, that should always be part of digital transformation. Step one should be a well thought out plan that you involve everybody. Step two should be the communication and engagement and getting everybody to understand what's going on and why. And the why is often forgotten. And then step three should then be the actual change or transforming these things. But we always get impatient. We're like, well, no, I've got to do this today. And sometimes it's understood. When COVID happened, we didn't have a lot of time to communicate and all that kind of stuff in the right way. That those are fewer than there should be. But most of the time we do have, like if we're going to implement a new EMR, then we have enough leeway to get communication and everything on board. And so I think those are the kind of things that I think we really have to take into account and say, let's think about our people, and then let's bring that stress response down. Let's have them be allies rather than enemies, right? And not enemy in the classic sense, but in just the stress response defensive posturing method. And then that'll give you a much better place. And then the amazing thing is when you do that right, your net promoter scores are always higher, even if the technology isn't working as intended, or you need some time to refine it, or whatever it may be. And people will give you a lot more buffer if you treat them right from the beginning and treat them as humans. We often don't treat them as humans, and we just treat them as employees and say, look, they got to go along because we pay them a salary, right? And that's really disrespectful to somebody because they're not there just for a salary. They're there to help you, help the patients, everybody else. And we should treat them according to that right way.
You make some really, really good points. I just want to call out very quickly the difference between doing something because I said so and doing something because it's in the person's best interest, because that has been an opportunity in my career where marketing and communications, kind of emphasis on the communications, has been a massive differentiator from an organizational perspective, because every organization wants to evolve. We all want to change for the positive. We want to make life better for our customers, if they're guests, patients, fill in the blank. We also want it to be better for our employees so they stick around longer, so they're more productive, so they're more passionate, right? Anything. But the disconnect can be between where we are currently and where we're trying to get. And if the CIO or the chief data officer or the CEO says, hey, we're going from point A to point B, and most of the organization is not behind those closed door meetings. They're not vetting different vendors. They have no say in the process. They're sort of fed the direction that the technology is going. And so marketing and communications, I think, and I've seen this in my career, is they can step in and sort of wrap the change in a framing that is accurate, that's transparent, that is authentic, and that really gets ahead of a lot of questions and a lot of issues that people will have. Because to your point, everyone complains about the current EMR, except for when they're told we're switching EMRs, right? It's that's when they love it. Like, oh no, we can't get rid of Epic, we can't get rid of Cerner. It's the best thing ever. Yeah, but for the past 5 years, you've been complaining about how bad it is, right? So, what do you think about the relationship between marketing and communications, that function, and the digital transformation function? Again, I know you've done this at a lot of big health systems.
So I think marketing communication should be embedded with pretty much any change that organization does, in my opinion, because to me, that's just out of respect for the people that are your audience, right? Because marketing communications is really what you're saying to somebody when marketing and communication is involved is, we care about you. We want to make sure we give you the right message. And so we're going to have somebody who's specialized in this area work with us to make sure we give you the right communication. And people are starting to realize that more and more now. That's where I think the neuroscience and the marketing kind of goes together, because neuroscience often is the basis, the scientific basis behind how marketing communications work, right? The way you phrase a word, the way you put an ad up, the way you put an image up, right? All those kind of things are based on how is that going to be responded to by the individual that's the audience, the target audience. And so I think, to me, I always, in any of the projects I had, one of the first people I called was marketing communications people, because they're fantastic at taking the science of communication into a whole different realm. And so for any project, and certainly major projects, you have to have them involved in some capacity. Now, again, you don't want to burn out the team that's there either, because oftentimes marketing is not your biggest team either. Like, they may have 20 people for an organization that's huge, right? And so you want to be careful about not burning them out either. But at the same time, the value add that they have when done well, when you have a good marketing team and they do a good job, the value add that they offer is immense. And it's actually measurable. People say, oh, you can't measure it, it's a soft science. No, you can measure it. You can measure how people are feeling, their stress response. There's specific metrics you can do for the audience. Net promoter, you mentioned, is one of them, but there's ways to understand how the audience is feeling and what the pulse of the audience is. And so there's ways to actually account for that. And that's, to me, is the process metrics, like how they're feeling. The outcome metrics are, do they leave? Do they come back? Do they, what's the turnover, the burnout, right? All reduced hours, all that. Those are the outcome metrics. But the process metrics are getting the pulse of your team before those outcome metrics happen. And that's the real key.
Yeah, that's a really good point. I'd like to sort of leverage that to segue into talking about the neurology of leadership. I know that's something that you're very passionate about. You've done a lot of studying on, because to your point, marketing is a lot of neurology, neuroscience, behavioral science, et cetera, applied. And then we can look at things that historically maybe we have felt like, according to the McNamara fallacy, we didn't even need to look at, right? Who cares about morale? You can't measure that. Well, now we have some subtle ways of really keeping our finger on the pulse of how our employees are feeling, how our customers are feeling, et cetera. But let's shift a little bit and just segue into that sort of the neurology of leadership. What should we know as people leaders on how we interact with the human brain? We talked a bit about the stress response for change and those sorts of things, but from a leadership perspective, what makes us better leaders?
Yeah, great question. I think, to me, it starts simply with, do I care about the people around me? And as
And
a
that
leader,
requires zero knowledge of neuroscience, right? But you make a good point, and that seems to kind of be the theme too, that to this conversation is, yes, we're talking about digital transformation, yes, we're talking about marketing, yes, we're talking about leadership, but do you care about your people? Like, humanize it. Don't just come in here with a bunch of data, right?
yeah, no, absolutely. I think it's a great point, Colin. I think the thing is, leadership is hard to execute, but the concept, to me, is very simple in many ways, right? Do you care about the people around you? And that goes two ways, right? Do they care about you, and do you care about them? But at the end of the day, it starts with the leader. And if you genuinely care about the people around you, that affects your behavior. And it's not necessarily always conscious, right? And this is sort of the neuroscience aspect of it, but how we really feel and think subconsciously affects our outward behavior. I'll give you an example with, it's a different setting, but it's with sales. So I was working with a sales team one time, and the way they were incentivized, is a lot of sales teams is based on commission, and more product you sell, the more income you make. And so some of the junior guys that are coming in and out of college, and they got to pay their bills and all that stuff, were always kind of stressed, like they got to make a sale and they got to meet their quota and all that kind of stuff. And that was inside of them. And no matter what they did to cover it, they couldn't cover it. And so that anxiety and stuff came out anytime they talked to somebody. And so then what that does to the person who's even evaluating a product, even if they like your product, they're not going to buy it from you, because it's just not a good energy, right? And so it's the same thing here. Is if you're a leader who is outwardly showing that you care, but you really don't care, it's going to show up in how you are. And being a good leader means, just first step to me is, do I care about the people around me? Do I want them to do well as humans? Not because I want them to be productive for me, but I want them to be good as humans. And this is the other subtle difference: is we often say we want to care for our people simply because we want them to be more productive, right? We want to take care of our physicians and burnout so that they can see more patients, right? That's not really caring about them. That's a means to an end, right? And so what you really want is to care for them and say, look, I care. Are you having a wedding? Are you having, whatever else is going on in your life, kid situation, right? And then caring for them and saying, okay, let's, as a simple example, if you got this going on in your life, how do we accommodate your work life to support that and still keep you productive, right? Now, it's not to say that we care about productivity alone, but in a job setting, you have to have some level of people doing your job. Otherwise, it doesn't function. But at the same time, how do we take care of you, right? So finding ways to be flexible, and can we let them work remotely? Can we, whatever? Can we shift deadlines? Things like that. And so, to me, those kind of things are tangible ways to actually show caring for the people around you. And for people around me, I always try to support what they're trying to do in that sense. Um, and then the second thing is, can you provide the right structure around them too? Because you can have a lot of good people, but if you have the wrong incentives on the team, you're going to change behavior in the negative way. So if you incentivize everybody differently, and those are competing incentives, then it's going to be hard. So I'll give you an example, as a healthcare example that's easy. Is in certain places there is this push to increase inpatient volume, but at the same time there's this push on the ER department to decrease visits to the ER and readmissions. Those are competing incentives because a majority of inpatient volume comes from the ED. So if you reduce the volume there, you're going to get lower volumes on the inpatient side. But the two teams had different incentives. If you increase inpatient volume, it affects you this way. If you get lower volumes on the ED, you get better incentives there. And they don't mesh. And the only way to really make them mesh is then increase the pool of patients that you're reaching out to, right? So if, say, you're serving 1 million lives and you can increase that to 3 million lives, then now you can accomplish both goals. You have few people returning to the ED, but the ones that need still come, and your volumes are good. But that's a very creative way to look at the incentives. But a lot of times you'll set up a team and give them competing incentives. And by the very nature of that incentive, which affects behavior, and that's really well right now in the book Freakonomics. I'm sure you've seen that and read that. But that, to me, is like
what gets rewarded gets repeated, right?
Yeah. Whatever incentive you have affects your behavior. And so having those right things. Now, to give you a contrary to that, there's an organization I know of that's in Houston where their entire incentive plan is based around their quality metrics, and they measure it through Vizient. And the entire C-suite on the way down, their entire goal is to be top 10 Vizient every year. Not top 10%, top 10 rank. And if they achieve that, then everyone gets their incentives. They don't have volume. They don't have, outcome as quality measure, but they don't have volume as part of that. They don't have throughput. They don't have length of stay and any of those things. They have quality metrics through Vizient. Are we top 10? And that, to me, that really says a lot about an organization that, that's the right culture, because you're focusing on the patient. Your healthcare, your product is care of the patient. And now what you're saying is our number one incentive for everybody is better quality. If we achieve better quality, everyone does well, and you get your bonus. And so that's the way to incentivize the right way and have everybody row in the same direction. So caring about your people, setting up the incentives, and then also setting an expectation of excellent work, not settling for mediocre, right? Consistent excellence persistently, right? And that is one of the big keys to that too. So because when you have one person that's mediocre and everybody else is doing their job, well, guess what? Someone's got to pick up the slack, and then it becomes a bad situation. It's the same thing. Like, I had a view of excellence when I was in Boston, seeing the Patriots there, and we worked with them a little bit with some of the concussion program. But what you saw was everyone had to be at a high level, and you had leadership and everybody that promoted that. And if you couldn't perform, then you couldn't be on the team because it affected the whole team. You can't have one cornerback not do their job well, which then affects the whole team, right? But it's not to say that you're mean to people. You can care about them, and if they can't perform, then you find a way to get them in the right spot, right? And I think that was sort of the genius of that. Like Devin McCourty started out as a cornerback, but wasn't the best cornerback, and he was shifted to a different position. He's a Hall of Fame safety now. But I think those kind of things of understanding how to promote excellent behavior from everybody through the right spot on the bus, so to speak. And I think those are the simple things. And then as a leader, all being able to articulate a vision. Like, why is everybody there? What are you trying to achieve? And being able to articulate that, stick to that vision. And then fourth, and the last is really just discipline to stick to that plan and not wavering when the winds blow, and making sure that everybody's on the same page. So I think it's conceptually not difficult, but executing that is very hard because all of us have our shortcomings as humans. All of us get tense. All of us have a stress response. And so having that, the value of what I add for a lot of companies is not just telling them something they already know, but really helping them execute on that. Because what I tell them, I mean, it's common sense in many ways. It's not, by the time you get to be CEO, if you don't already know these things, there's a problem.
Right.
And, but the execution of that is where you need a coach or help to get there. And it's the same thing as, if you have LeBron James, he's arguably the number one basketball player in the world right now, but he still has a coach, right? And he still has a whole team around him, like nutrition and diet, all that stuff, exercise, trainer, all that stuff that helps him perform at a peak level. And I think that's the same thing as we don't use that in other realms. We accept it in sports because everyone has a coach, and it's not a downfall to have a coach. But for whatever reason, in other industries, when we have a coach, it's like, oh, you have a coach. Is there something wrong? No, I'm trying to peak performance, right? I'm trying
Well,
to
and the
optimize.
funny thing with that too, sorry to butt in, but
No, no.
I've seen this happen too, where we think, oh, in something like sports that's very simple, there's instant feedback. Did you win? Did you lose? What mistakes did you make? What did you do really well? You can review game film very simply, instant feedback. And then we have something much more complicated like marketing. Well, if you have a 120-day buying cycle or sales cycle, that might mean that what you're doing in January, you don't know if it worked well or not until June. And so the ability to review game film, so to speak, the ability to get instant feedback is really challenging because you're not looking at the entire spectrum of things instantly. You might be able to look at, landing page clicks or email open rate or email response rate, something like that that's a little bit more instant. But ultimately, we can't just look at feedback on individual plays, to stick with the sports analogy. We really have to look at what's the entire team doing holistically and how are we being successful. And so that's where I think, to your point, bringing a coach in, talking to people that are outside of your organization to help give perspective can be huge.
Yeah, absolutely. And having an outside set of eyes too, right? So,
Yes.
coach in this setting is not simply someone who just gives you advice one on one, but oftentimes, with some students, they'll bring someone as a coach for the whole team, and they'll observe their meetings, right? Or observe different smaller places, right? So that's one part of it. And the other part of it is not just the soft part of the observation, which oftentimes can be very subjective, but also combining that with hard data, with actual psychosocial metrics that are out there. And so there are scales and measures, just like we use for healthcare. We have, radiology, we have labs, we have other things that supplement the history and the physical exam, right? What you say to somebody, how you get the story, what's going on, the examination, but then you supplement that with lab values or radiology, right? So you can do the same thing in a coaching setting or executive setting is, can we measure you? Can we measure your moments in terms of like, are you a risk taker? Are you risk averse? Are you someone who gets stressed easily? Are you someone who has this kind of personality, right? Those are things that are very, those are can be ascertained through specific objective metrics, which then can give insight into who an individual is and how they behave. And so, if I were to do that on you, Colin, I get all the metrics, and I say, okay, so if I know from these metrics, then I know that if Colin is in situation A, these are the likelihood of his reactions in that situation. In situation B, this are the likelihood of him. And then knowing that, we can then work on your strengths. We can work on your weaknesses, right? And you're very powerful. You're strong. Like you may not need a lot, but all of us can refine some things, right?
Exactly.
Um,
Yes.
and it's a way to get better because at that level of the C-suite level, it's the margins of excellence and mediocre are very thin, and it just takes small steps to go from. It takes a lot of effort, but the difference between excellence and mediocre is very thin. Just like in NFL, like you'll hear every week a coach say, the difference between winning and losing was 2 plays, and
Exactly.
but that is the difference between winning and losing. And like the Patriots, they won 6 Super Bowls. Not a single one of them was more than by a touchdown, right? Like except maybe the last one, if I remember correctly. But anyways,
And
but the
I just want to
majority
be
of
very clear. All of that success was due exclusively to your work on concussions. I'm pretty sure.
it. No, uh, no. I think it's just amazing that they had such level of excellence for so long, and I have an attachment to them because I was in the Boston area and I got to see some of those things up close. But it's just amazing that that team was able to maintain a level of excellence for so long. And now you see that with the Chiefs now is that they're able to maintain that level of excellence for a continued period, right? And and in observing them, I learned what excellence means too, is in the sense of the amount of effort you make from being average to great is huge. Now the difference may not show up more than a couple plays a week, but those couple plays, you add them up over time, and is what the difference between okay and awesome. And as an organization, it's the same thing. If you look at that book, Good to Great, and you look at their, look like what that book does is look at companies that over a 15-year period outperform the market. And if you look into the details of it, it's really just a few key plays every week,
Exactly.
and that add up. And I think those are kind of cool things. And there's so many ways that the value of incremental gain, and we don't realize that a 1% change on a day-to-day or a week-to-week basis is huge over a year or 2 years. And the ability to do that is quite a bit of effort, but that effort makes us all better. And if we truly want to be great, that's what it requires.
It's interesting. I was having a conversation with somebody. It's probably been a year, maybe 2 years, about compound interest, and we all think about compound interest on money, right? Okay, I can get a 7% interest rate, a 12% interest rate, whatever. The compound growth of what's going on, because the interest then adds to principal, and then that grows, and so on and so forth. But he was shaping it in the context of compound growth on skills, on leadership, on marketing, on fill in the blank, and thinking about what are the books that you can read, the podcasts you can listen to, the people that you can surround yourself with, the mentors, the coaches, etc., that now will allow you to level up in a way that will compound over the next decade or multiple decades. And that to me is exactly what you're talking about. How can we show up and do well from a leadership perspective, from a culture perspective, from a humanization perspective, and then obviously digital transformation as well. That's key. But when we're thinking about these big digital transformation projects out there in the marketplace, how are we thinking about our small human transformation projects individually, right? And then what does that do from a compounding perspective? So that really resonated with me and made me think about a conversation a couple of years ago. So very cool.
It's a great point. And I think that I love that concept of the individual compound interest, right? And compounding your growth. I, it's, to me, the first step in that is wanting to be better. And everyone says they want to be better until they realize what it means to be better. And
Yes.
because the process is not easy, and can be quite painful, because when you put a mirror up to yourself and you see your faults, right? And it's scary. And then the work it takes to make the change mentally, physically, etc., is hard. And it's like losing weight, right? Everyone wants to lose. Majority of people want to lose weight, but then you say, okay, well, I gotta exercise, or I gotta eat right, or I gotta give up my favorite food, or whatever it may be. And they're like, it's okay. I'll have this one bite today, or I'll start tomorrow, right? And it's easy to fall into that trap. And it's the same thing with personal growth. It's easy to fall in the trap of, yeah, I want to do it, but I don't want to give up anything to get there, right?
The first step's always admitting we have a problem, right? I mean, it really is.
Yeah.
How big is the problem, and do we want to make the changes necessary to maintain that? And not to make this a research conversation podcast, but a lot of research has gone into cohorting and the power of, I don't want to run, I don't want to get up, I don't want to do these things, but if I join a group of people who hold me accountable, and that starts to become my new normal, right? I'm part of a group, and we are a group of runners, and so we run, and I associate with them, I'm much more likely to achieve my weight loss goals or my fitness goals, or what have you. So very interesting to think about what we're doing individually, how we can leverage coaches, mentors, cohorts, etc. Dr. Purohit, this has been a fantastic conversation. I've really enjoyed it. I've learned a lot. Anything else that we didn't get to talk about that you would like to leave our listeners with? I know this has been a wide-ranging conversation talking about data transformation and digital efforts, humanization, a lot of things with the healthcare system, putting people first, making sure that we understand our different stakeholders and everything. But anything we didn't touch on?
No, I think, Colin, you did one, first of all, outstanding job with the podcast and the questions and the topics. It was a lot of fun. You kept the fun light, and really a lot of depth to your questions. So very impressed with how you did things.
I really
No, I
appreciate
think
that.
that,
Thank you. I
oh,
know you do a
absolutely.
lot of these, and that means a lot.
Yeah, it's not easy to do what you do. It seems easy on the outside to just come up there and ask questions, but I know it takes a lot of, because I do the same on my podcast, is it takes a lot of depth to research the person, the questions, and then, have a flow to it. So it's a lot of effort that people may not realize. I think the only thing I'd leave them with, one outside of outstanding job by you, is simply, I think the role of neuroscience for success is quite huge. And it's not really just healthcare leadership, but really any leadership anywhere. There's a strength of commonality across all industries and aspects. But the role of what understanding how our brains function allows us to understand how we behave and act. And then as a result of that, we can create a better culture, a better team, and better productivity, and really be our best selves if we know how the brain works better.
I love that. That's great advice, or great insight, I should say. And Dr. Purohit, we are the Rethink Marketing Podcast. So we like to ask each guest, what is one thing that you are rethinking? I'm sure in your world, there are lots of things. So it could be personal, it could be professional, but what are you rethinking?
Well, I'll give you, I guess, a personal example. I think it's this basic concept of health for myself, actually. So I'm a physician. I see patients all day. I also work with companies and all that. And then my wife, one day, I think jokingly, I hope jokingly, said, you should really think about the advice you give others and think about it for yourself. And so I really started taking a look at that for myself and saying, okay, what do I do tell people on a regular basis of doing things? And what do I not listen to myself? And what should I get better at? And so, one thing, I'd stopped working out for quite some time. And so I tell my patients every day to walk because it's best for their health, for stroke, et cetera. And I realized I myself was not doing that. And so to recalibrate myself and follow my own advice, I'm making sure I have a part of my day for my own personal focus and well-being, because when I'm exercising, my mental health is better, my physical health is better, and I can actually be a better leader and team player as well. And so rethinking your exercise routine as an investment of time rather than a loss of time is what I would say.
It comes back to that compound growth. I mean, it really does.
It does. It does. The problem is I have too many recessions in my plan.
Yeah, that's right. Well, that's fair. That's fair. Well, Dr. Purohit, this has been a fantastic conversation. I've thoroughly enjoyed it. I'm sure that our audience has as well. Thank you again for making time to join us today. I hope to keep the conversation going with you offline, because this has been very, very enjoyable for me. But thank you again for making time.
Absolutely. Anytime, Colin. Thank you for having me.
Absolutely. My pleasure. Everybody, thank you for joining us today on the Rethink Marketing Podcast. Until next time, keep rethinking those common assumptions. Thank you so much for listening to today's episode. If people want to connect with us, where should they go, Paul?
RethinkMarketingPodcast.com, Colin. What can listeners do to help us in return for this sage marketing wisdom and our pithy humor?
They can help us by leaving a review on their favorite platform or sharing this episode with a fellow marketer to help them cut through the clutter.
Well, until next time, keep rethinking those common assumptions.